Unipolar disorder, also known as major depressive disorder, is a common mental illness that can affect people of all ages, including children. Despite its prevalence, there is still a significant lack of understanding about the underlying mechanisms of unipolar disorder in children, as well as effective treatments for this population. In this podcast, we review the current state of knowledge on the epidemiology, etiology, diagnosis, and treatment of unipolar disorder in children. Unipolar disorder is a major public health concern that affects people of all ages, including children. According to the National Institute of Mental Health, NIM, an estimated 3.2 million children aged 12 to 17 in the United States have had at least one major depressive episode in the past year. Despite this high prevalence, there are still many gaps in our understanding of the underlying mechanisms and optimal treatment strategies for unipolar disorder in children. The epidemiology of unipolar disorder in children is complex, and there are many factors that contribute to its incidence and prevalence. According to the NIM, the prevalence of major depressive disorder in children and adolescents is around 3%. However, there are significant variations in the prevalence of depression across different age groups, genders, and socioeconomic groups. Risk factors for unipolar disorder in children include a family history of depression, exposure to stress and trauma, and certain medical conditions. In addition, there are significant disparities in access to mental health care for children with unipolar disorder, particularly for children from low-income families or minority backgrounds. The etiology of unipolar disorder in children is multifactorial, and there is no single cause of this disorder. However, there are many factors that have been implicated in its development, including genetic, environmental, and neurobiological factors. Genetic factors play a significant role in the etiology of unipolar disorder in children, with a heritability estimate of around 40%. There are several candidate genes that have been identified as potential risk factors for depression in children, including those involved in the serotonin and dopamine pathways. Environmental factors also play an important role in the development of unipolar disorder in children. Stressful life events, such as divorce or the death of a loved one, can increase the risk of depression in children. Other environmental factors, such as poverty, abuse, and neglect, may also increase the risk of developing depression. Neurobiological factors, such as alterations in neurotransmitter levels and brain structure and function, have also been implicated in the etiology of unipolar disorder in children. For example, reductions in the volume of the hippocampus and prefrontal cortex have been observed in children with depression, and abnormalities in the hypothalamic pituitary adrenal (HPA) axis have also been reported. The diagnosis of unipolar disorder in children is based on a combination of clinical symptoms and criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The DSM-5 defines major depressive disorder in children as the presence of at least one major depressive episode lasting 2 weeks or longer, characterized by a depressed mood, loss of interest or pleasure in activities, changes in appetite and sleep patterns, fatigue or loss of energy, feelings of worthlessness or guilt, difficulty thinking, concentrating, or making decisions, and thoughts of death or suicide. It is important to note that the symptoms of depression in children may be different from those seen in adults, and may include irritability, physical complaints, and social withdrawal. In addition, depression may present differently in children depending on their age and developmental stage. The treatment of unipolar disorder in children is complex and requires a multidisciplinary approach that involves mental health professionals, parents or caregivers, and educators. The treatment goals include reducing the symptoms of depression, improving functioning, and preventing relapse. Psychotherapy, also known as talk therapy, is often the first line of treatment for unipolar disorder in children. The most commonly used psychotherapeutic approaches for depression in children include cognitive behavioral therapy, CBT, and interpersonal therapy, IPT. CBT is a structured, short-term therapy that focuses on identifying and changing negative thoughts and behaviors. The therapist helps the child to identify negative thoughts and beliefs that contribute to their depression, and then teaches them skills to challenge and change these thoughts. IPT is a form of psychotherapy that focuses on improving interpersonal relationships and communication. The therapist helps the child to identify and address interpersonal issues that may be contributing to their depression. Both CBT and IPT have been shown to be effective in reducing the symptoms of depression in children, and may be used alone or in combination with medication. Medication. In some cases, medication may be recommended in addition to psychotherapy for the treatment of unipolar disorder in children.